Have you heard about the secret herb that can cure you, that can cure your diabetes in a week? Would you like to lose 30 pounds in 30 days? Stay tuned for some answers to your issues.
Would you trust this gentleman? This is my good friend and colleague, Bill Polonsky, clinical psychologist, specializing in the emotional and behavioral issues of diabetes. You should know him by now. I'm Steve Edelman, and today we're going to talk about trust with your caregiver. And it's a big deal because we've discovered, and there's been lots of research to show, the more trust a person with diabetes has with their caregiver, the better they do. The more adherent they are to medications, the better their hemoglobin A1C. Now, for me personally, I hardly ever trust a doctor that puts this around their neck, because no one really does that, especially diabetes doctors. If you're my patient, you may have noticed that when I listen to your heart, if I did listen to your heart, I hardly ever have this thing on my ear. Why? It's not that important. I'm here to talk about you, your diabetes. I'm here to listen to you. So I think we're going to go through some of the characteristics that have been related to patients with diabetes, people with diabetes, and trust.
And again, I think that's so important, because if you have a doctor and maybe you've worried that maybe he's just nearly not on your side, maybe he's just there to sell you drugs because he's connected to big pharma, or you've seen him on an infomercial. I mean, you got to be careful. How do you decide you can really trust this person who's going to help you manage your health effectively? And so we've got some ideas that we're going to talk about.
Yeah, I mean, this person should be your partner. And they're the ones giving you ideas and suggestions for you to improve your diabetes. And let me tell you, there's a lot of different ways to skin a cat, and you have to individualize therapy. And you have to feel good about trusting your doctor. I can say this again, tons of research have shown that if you don't trust your doctor based on validated questionnaires, you end up not taking your medications like you should, and not doing a lot of the things that really should be there to keep you happy.
Yeah, and actually, if you don't,
and healthy.
And if you don't trust your doctor, you probably shouldn't be taking your medications.
What's the first important thing?
Well, there's a bunch of them.
Yeah.
Of course, probably the most important one, I mean, how do you decide if you can really trust your doc? The most important one is, are you sitting with someone who you feel is actually listening to you, who isn't just treating you like a number, isn't just repeating and telling you what to do over and over again, even though you may be protesting. But even though your time may be limited, is that someone who's really listening to you and hearing you? I think that's the most critical thing.
Yeah, and there's been research to show, and I think Bill's told me about this research, that the average time it takes for a caregiver to interrupt one of their patients after they open up the visit is about 13 seconds. So listening is important.
Yeah. And the other important thing, in addition to that, and this is related to listening, is do you feel like when you meet with this physician, is this someone who's really involving you in making the decisions that are important for your life? Isn't just telling you what to do, but is involving you so that you come to some collaborative agreement about how to proceed forward. That's also really critical. That can help you decide whether there's someone you can trust.
I would never tell you, Bill, to double your Prozac dose. I would say, Dr. Polonsky, I noticed you've been acting a little weird lately. What do you think about doubling your Prozac dose? There's a perfect example. It's not a joke. What's number 3?
Well, a third one is, do you feel like when you're sitting with your healthcare provider, your physician, that he's really putting your needs first? I mean, it's understandable that most physicians are going to have some awareness or maybe have some pressure from external sources about your healthcare system or from a pharmaceutical company, whatever it might be. We've got these complexities in our lives. But when you're sitting in that room with your physician, can you feel confident? And do you feel this person is putting your needs first? That's critical.
You know, I saw a patient yesterday. That's the timing of this Edelman report is perfect. She was so concerned about a report she read that 1/3 of drugs approved by the FDA have side effects. And if I didn't address those issues and concerns, we weren't going to go anywhere past that point. And I think, I validated her concerns, and I wanted to make sure she felt comfortable about starting this new medication that we started yesterday. Or I hope she started. Have to check to see if she picked up her prescription.
Yeah, and I think the last one, and I think you just actually addressed it, which is related, is do you feel like your physician does he really understand your issues, your problems, your treatment, what you struggle with, especially when you talk about diabetes, which we know is so complex and often confusing, and it's so much about what you do at home every day. do you really feel like your physician is empathetic to that and has taken the time to understand your perspective on things? And you can see that's part of the listening idea.
That's part of the listening. It's part of putting the patient first. There's a lot of important things about that last point, and I think, I think you've spoken to a lot of your physicians at our conferences, and you've given them suggestions, in terms of like, how would you open a visit, and what about how would you close a visit with your patients? I know opening a visit is, hey, Mrs. Jones, tell me what are the hardest things that you're dealing with your diabetes. So I've never asked you this question in public. What do you say as your last question?
Well, I would say the last thing, I don't know if it's the last question, is I think it's always important to take a moment and summarize what your patient has said, what you've heard, and what the actions are going to be. So when you can say, look, Mrs. Smith, here's what we've been talking about, here's what your concerns, here's what I said, here's what we decided, if I'm correct, we're going to now do moving forward, what you're going to do and what I'm going to do I have that right? Not only does that help you as a physician to make sure we're clear and that we're clear with our patients, but it's also an extraordinarily powerful way of saying, I have listened to what you've had to say. And it's a good way of bringing everything together.
Well, that was a question. You asked is that everything that we agreed upon?
Yeah, I guess at the end it ends with
just confirming everything.
Yeah.
So in ending this Edelman report, I want to say, Bill, I really, really trust you. Thanks so much. So long, nation.